My name is Fred Sandoval. I'm the Executive Director for the National Latino Behavioral Health Association. Thank you for joining us today for our series called Pláticas, Latino Wellness During COVID-19. NALBA is a nonprofit organization dedicated to the well-being of Latino families and communities in New Mexico and across the United States. Our mission is to address the disparities affecting the behavioral health of Latinos. We're so excited to host this Facebook Live series on how Latinos and their families can and do take care of their well-being, their emotional, physical, and spiritual health situation during COVID-19. I'd like to thank our partner, Morehouse University School of Medicine, for helping make this series possible. Each month in this 2021 calendar year, NALBA will host a professional expert in public health, behavioral health, or the field of medicine, as well as other advocates and community members to share their insights, their experiences, and expertise on taking care of yourself, your family, and your community during this COVID-19 pandemic, and to also share what resources are available to help. To get us started, here is how our Plática will work. I have several questions that we have ready and prepared to ask our guest speaker, who I'll introduce in just a moment, and that'll get our conversation started. But you as the listening audience can participate too, so please type in your questions, or if you have comments, I'll be sure to share those with our presenter. So I think we're ready to get started, and I'm just so excited about this opportunity to introduce a colleague, a friend, a mentor, a leader who she has devoted her life to serving New Mexico. She's really the epitome of service to our state, and it just gives me great honor to make an introduction. And she did send her bio, and so while I'll read the bio, I do want you to know that I will ad-lib periodically because there is so much that the bio didn't get to say, but it's important for me to make sure you know that the context of who we have today is just a gift to NALBA and to our state to be able to have her speak about the work she's been involved recently, which we're going to learn about in just a second. So Dr. Dolores Roybal, she's of course a social worker by training, and given the work that she's done in New Mexico, she has applied all those social work principles and practices in her career. She is the recent former director of the Con Alma Health Foundation, and she served in that role for 15 years, and she completely dedicated her work to that organization to help make it what it is today. As a native New Mexican, Dr. Roybal has 45 years of experience in the nonprofit and philanthropic sectors. She currently serves as a board member and officer of the New Mexico Association of Grantmakers and with the U.S.-Mexico Border Philanthropy Partnership. She's a former board member, including membership on such boards as the Grantmakers in Health, Hispanics in Philanthropy. She holds a master's degree from New Mexico Highlands University and a PhD that speaks to the work around organizational behavior and development with a focus on nonprofit management, philanthropy, and nonprofit. Dr. Roybal is now, as I said, retiring, and just recently, so it's probably just a matter of days since she's been retired. So we're excited that she's here with us today. And more importantly, she continues to do work with the Con Alma Health Foundation, which is going to be very helpful to our state to be able to see her in that continued leadership role, serving our state. She's dedicated to building and cultivating partnerships that have really helped prove that when you work together, you can impact people even more so. So that's the introduction just to get us started. And I want to just say, Dolores, what a treat it is for me to welcome you, because you know, I just have great admiration for you. What you've done for this state is immeasurable. So for the Facebook listening audience that's here today, they're going to get to learn even more about you. So let me just say welcome, bienvenidos, and you should say a little bit more about yourself, because I think the more people get to hear about this from you, the more they'll come to appreciate, you know, the fact that everything that you've done in your career, and I can actually remember how far back that goes, because I remember us working together many years ago, but share more about yourself and your work, and then we'll get started with the other questions.
Thank you so much, Fred. First of all, let me say that the feeling is mutual. It has been my honor and pleasure to work with you over the years, and I actually have a 45-year history in the field. Thank you to NALBA, to the National Latino Behavioral Health Association, for inviting me to be part of this program and for all that you do to improve health with our Latino communities. I also want to thank all of you that are joining us on this Plática today. I think one of our greatest resources is our time. So thank you very much for taking a little bit of time to talk about this very important topic. I appreciate the title of this Plática, Latina Well-Being During COVID. Oftentimes, so many people approach this work from a negative perspective. So the strength-based focus is something that has really defined my work, both at CONALMA and throughout my career. In terms of a little bit of information about myself on a personal role, I am a Norteña from the Española Valley. I'm the matriarch of my family. I raised with my husband 5 kids, 8 grandkids, and we have a new generation of 3 great grandbabies, 2 of which were born during COVID. That was quite the experience. My husband, some of you may know, those of you from the area, he's Paul Roybal. He's a high school teacher, retired coach, and artist. And we have again lived in this area for generations. I am fortunate that I've had a lot of experience in terms of the nonprofit and philanthropic sector, primarily in health and behavioral health. And in fact, my first job after getting my master's, and actually, Fred, it was from the University of Denver. My undergraduate was from New Mexico Highlands, but my MSW was University of Denver. So after I got my master, my first job was at the Forensic Hospital in Las Vegas, which was, of course, a behavioral health treatment for a certain population. I also helped start the first community mental health centers in New Mexico almost 40 years ago. So, you know, as Fred and I have both said, I have a long history in this area. I am a social worker by philosophy, practice, and training. Although I've had a lot of titles, that is the one that I most resonate with. And those of you that are social workers know that we don't ever retire. We just have more time to volunteer, right? Fred and I were talking about that before we started this program, where regardless of whether I'm paid or not, I'm going to still do the work that I love and that I have been blessed to be able to do. So do you want me to say anything more, Fred, or do you want to continue with your next question?
Well, we'll continue with some more questions, and of course, we'll get to sprinkle in things about your background and your experience and everything that you bring to the table, because it's in large measure been so critical to how that's influenced your approach and your strategy to addressing health equity here in New Mexico. And I really look forward to hearing more about that. So folks who are listening in today and even with the recorded version, we'll get to learn about what those efforts have done to make changes in New Mexico and how that's helped, particularly now with the pandemic. And I do want folks to know that it's actually much credit to you and the CONALMA Health Foundation for actually helping seed these Pláticas. So it's important to give credit where credit is due, because when we started these Pláticas, when the COVID pandemic hit, I reached out to you, and you in short fashion were right up to bat. And so Dolores, thanks for that. And in fact, Morehouse University School of Medicine picked up on it, and so did the Office of Minority Health. So believe me, you're always front and leading the pack, and it's great to share that leadership role with you. So what I'd like to do is, ask you a question about how New Mexico's response to mitigate COVID-19 has been different than other states across the nation. So while we work in New Mexico, really we get to hear about what is happening across the nation. And in your work in recent years, you have been very instrumental in helping New Mexico really, in some ways, lead the nation in many respects. And I say that because there's documentation of what has happened, but your role, particularly in this area, is just so significant that today is a chance to highlight that and showcase that. But yeah, I'd like you to say a little about how New Mexico's response has been different than other states.
Thank you. New Mexico certainly is unique in many regards. Part of our efforts include our collaboration with the New Mexico Department of Health. Through a grant from the Kellogg Foundation, a $2.5 million grant, CONAMA has been able to participate in a vaccine equity effort with the New Mexico Department of Health's equity plan, with the University of New Mexico, and with other organizations, in order to really focus on vaccine rollout in particular. New Mexico's many characteristics, both in terms of strengths and challenges, have certainly played a role with COVID. That includes our large geographic and largely rural nature of our state, as well as the high percentage of people of color. And I think we all know that people of color have disproportionately been impacted by COVID. And that certainly is the case in New Mexico, particularly with the Hispanic and with the Native American population. With that said, New Mexico has actually done an incredible job, particularly compared to other states, regarding the COVID pandemic. And that includes efforts such as going out early through the leadership of our governor and implementing certain protocols such as social isolation, the mask mandates, other activities such as the immediate and rapid rollout. And New Mexico, I'm happy to say, has hit its goal of 60% people vaccinated. So many of the restrictions, or actually all of the restrictions, will be lifted on July 1st. New Mexico is ahead of most states in terms of getting shots in the arm. And I think that this, again, is attributed to many characteristics that New Mexico has, such as centralized government and health department. And you certainly know this, Fred, as a former deputy secretary for the Department of Health. We have many partners too in the philanthropic sector and nonprofit sector that have contributed to the vaccine rollout and other efforts regarding the pandemic. So for example, CONAMA Health Foundation last year received a $1 million grant from the Robert Wood Johnson Foundation as part of its national humanitarian effort for COVID relief and recovery. CONAMA also received, prior to the current grant of 2.5, last year CONAMA received a $500,000 grant that CONAMA matched with local and national funders, such as Hispanics in Philanthropy and many others, to support vaccine efforts and COVID relief and recovery for the large immigrant population in New Mexico. CONAMA has made many grants for this effort, and I'll speak to those in a little bit in terms of the types of grants. But overall, I think this kind of collaborated multi-sector approach of government, federal and state support, tribal support, and the nonprofit sector, along with our business sector, has made a difference.
Yeah, yeah. Thank you for describing kind of the breadth and the scope of this work, because the collaboration isn't just between two organizations. This is multiple organizations, state agencies, public agencies, as you said, the philanthropy community, community-based organizations. And if you think about how much it takes to really concert that effort and then to have the impact that it has, it's been just remarkable. So congratulations to you for being able to put your arms around such a large undertaking, and then, as you said, to manage the resources that have been awarded by the foundations to really help leverage other resources. And with all of that, I loved when you talked about how you worked with community organizations through mini grants, and mini grants is a very effective way of being able to mobilize many different groups across the state, because oftentimes what we don't realize is that the state is huge. To go from Shiprock to Hobbs, to go from Clayton to Silver City and everything in between, Conalma has really a broad reach, and so do the efforts of this entire collaborative effort. And yeah, I'd love to hear more about the mini grants and what you found to be impactful in relationship to that, the types of organizations that came forward to really be part of that bigger collaboration, because these are the folks that are in the communities, on the ground, helping families who are reaching out due to job loss, due to food insecurity, or due to circumstances that were way beyond their control. So I'd love to hear more about the mini grants and see where those projects are today.
Thank you. So in addition to basic needs such as food, housing, utilities, economic relief, Conoma also provided grants to nonprofits around the state for COVID testing, such as the Mora Health Clinic, and PPE supplies that we did throughout the state to many different organizations, assistance for medications for those that had no other way to obtain them, and even childcare costs. Because again,
Mm,
CONALMA defines health very broadly. It includes behavioral health, oral health, environmental health, economic, and spiritual health and well-being. So health is more than health care, and that's where the equity perspective comes in. So some of the support also supported some of the increased need for crisis management and behavioral health services, including the increase in domestic violence. So
mm,
examples of that are, we did give some organizations funding to increase support for transitional housing for victims and families that were affected by domestic violence. There was and continues to be an increase on crisis intervention, particularly youth. As we all know, were very isolated because of schools having to close. So we saw a lot in terms of the behavioral health side. And again, this was throughout the state. We also funded programs such as the New Mexico Center on Law and Poverty to inform individuals about their rights to housing and income support, to provide legal assistance to clients that might be impacted by eviction. And we provided services for veterans that were in need of behavioral health or other kind of basic needs.
yeah, thank you for describing what is one of the most significant benefits of the work that you've led, particularly because as people lost jobs, lost income, many lost housing, lost their homes, and then there was that period of time where people were still at risk of losing their homes or even their mortgages, right? Because of the fact that they weren't employed and, the payments that people get behind on. And clearly it just means that the safety net that was put in place took a lot to be able to ensure that people would not be without the basic necessities. It's shocking in some ways to think that here we were in a nation with such incredible resources, but the pandemic really buckled us at the knees. And one of the things that I shared with the director for NIDA at a conference for the American Health Insurance Plans this morning was that, as you said, the mental health impact on all of us not only occurred early on, but continues to happen, and that there'll be continued impact as it relates to how our well-being, because of the isolation, the loneliness, the worry. Particularly Latinos were very worried, and that worrisome takes its toll, right? Because it doesn't immediately go away. But there was something that was said today that I want to share with you. The NIDA director, Dr. Nora Wolkoff, said that they had anticipated that across their nation that there would probably be an increase up to 30% in substance abuse, and particularly as it relates to opioids, given the number of overdose deaths that took place during the epidemic for COVID. The epidemic for opioid use was continuing to happen. So I shared with her that in the area where our organization is doing prevention work, is our data shows that there was a jump of over 300% of fentanyl use in northern Santa Fe and southern Rio Arriba County. And so it tells us that people are struggling, right? And so now with the resources that have been brought to bear on helping our families, what do you see happening over the next year? What do you project will happen with the collaboration that's taking place? And what efforts do you want to see come to fruition, come to life? Because in some ways, you're really expanding the efforts and supporting communities even more so. So what do you look forward to seeing happen over the next year?
I think, to answer that, I would start by saying that what distinguishes Konama Health Foundation's work is our focus on health equity. And that is where, on ensuring that everyone has the opportunity for good health, regardless of race, ethnicity, or income. And so that means that it requires removing obstacles such as poverty and increasing access to services and healthcare and other opportunities related to equity, such as affordable housing, a good job, educational opportunities. And so in answer to your big question, I think is that what we try to do is to look at both COVID relief and recovery. You'll notice that in all of my responses, I include both. That means that we need to look at both short-term needs, such as a rapid vaccine rollout, so that we address both those that may have barriers to getting a vaccine, because of transportation or age or other barriers, as well as those that have vaccine hesitancy, due in part to misinformation or stereotypes or political or religious beliefs, whatever that may be. So it's looking at both the short-term and long-term systemic barriers. That includes supporting the work that your organization does in terms of building a culturally appropriate behavioral health workforce. That means having a health workforce, community health workers, health alliance that are culturally relevant. That means removing barriers such as the digital divide, the lack of broadband in New Mexico. That means having, access to affordable housing and protecting people from, eviction. So there are, many answers to that question, but the main one is the short-term and long-term.
Yeah, thank you for sharing that. And just really real quickly here, I want to make sure you got a shout out from Carmen Rodriguez. She says, good to see you, Dr. Roybal. And we have another colleague who frequents us regularly, Valerie Romero. And hello, and a shout out to her. Our colleague down in El Paso, Texas, who visits and frequents our Pláticas is Corinne Chacon. And so hello, Corinne. And she says, hello from El Paso, but she says these increases in opioid and fentanyl abuse are alarming. I want to share something with you that I heard from a group of community health workers that we did a focus group with. And Dr. Roybal, you'll particularly appreciate this because, we feel and are fully committed to ensuring that what we know and what we learn is informed by our communities. And so it's important for us to be engaged, to hear what people in the front lines, essential workers, and how our community members, our families are feeling, what they're experiencing, so we know firsthand. So there was two things that was shared with me that I'd like you to respond to, because you are very right to say that, how is it that all of these things can be done, and who is it that helps? Well, in this focus group of community health workers, they said two things to me that have left a very strong impression on what I think I need to try to help with in whatever way possible. And one of them was they took such great pride in being called essential workers, right? So in other words, people were validating how important their work is as community health workers, and described them as being essential to this effort against the virus. But then proceeded to tell me two things. One is how scared they were, particularly at the onset of the pandemic, because that meant they didn't know a whole lot about the virus themselves and were feeling very vulnerable. And as they said, simply scared. It took some time to kind of work that through. So the mental health impact on them was fairly evident. Then the other one was they were saying, we work weekends, we work weeknights, sometimes on holidays, and some of us don't even get paid at all. And so there was an expectation that as community health workers that they not only be in the front lines, but somehow some of them were getting paid. So that's a significant issue, right? Because the vaccine efforts, the encouragement, the community education, the campaigns to let people know where resources at, oftentimes are done by community members, such as community health workers. And how would you want to mitigate those kinds of situations so that those don't happen in New Mexico, right? Because this is in southern New Mexico and in the El Paso County area. But what would you say would be important to help support community health workers to be able to take that charge and help us, help our communities, and help our families?
Thank you for asking that. There are a number of efforts underway. They're not enough, but there are efforts underway. And I want to start with the New Mexico Department of Health and the work that it's doing and funding that is being provided, and collaborative efforts for both the Alliance of Health Councils around the state as well as community health workers. I think that that's a very important initiative. The hitch, of course, is that we need to continue it past whatever term of funding is currently available. That sustainability in terms of supporting and strengthening and having sustainable funding for these networks of community health workers and other frontline workers is critical. We have funded certain organizations, agencies to do this work, such as the New Mexico Caregivers Coalition, as well as the New Mexico different organizations such as the Center for Health Innovation, Public Health Institute, for some of the work that they're doing to improve the capacity of the COVID response by training and credentialing culturally and linguistically appropriate care workers. So those types of efforts individually are important, but what's most important is that it be an integrated long-term effort that goes post-COVID, that it doesn't just address the current public health crisis, but that we strengthen these networks, these frontline workers, both in terms of, benefits, not just now, but going forward. New Mexico Voices for Children did a report about a year or so ago with other partners, and they called it, I think, essential but excluded, meaning that there are certain populations of our workforce that are essential workers, including immigrants, but they're excluded from getting any kind of benefits. And I think that those kinds of systems, again, really have to be addressed. And I'm happy to say that CONAMA has been a longtime supporter of both the Alliance of Health Councils and the community health workers for many years, but we can't do it alone. There has to be a lot more support.
Yeah, that's absolutely right. Well, I want to share with the listening audience that way before our current president, the Honorable President Biden, talked about health equity, Dolores Roybal was carrying that banner. So really, if you count the number of years where you have really led the charge on how health equity is the way of solving and addressing and acting on these disparities, because its focus is on solutions rather than just being aware that the problems exist and that the disparities are there. And so health equity is very different today than it was even 10 years ago, right? And I think it holds in tremendous hope for New Mexico, for our country. But if you think about how far ahead of the pack you've been on this health equities approach, right? Because what it does, it tears down barriers, it starts to fill in gaps, it challenges those very issues that are problematic. And health equity is really an incredible opportunity in our nation to now solve and resolve and take on bigger challenges, right? When we think about how systems work and how well they don't work, and how will health equity look like in the next few years, given now there's a larger federal response around that, and how that can, in fact, really reinforce the message that you led the charge on way before the nation was saying health equity. I'm hearing it almost every day now. And so you want to say something about that? There's a little magic stew there that we should talk about.
Well, thank you, Fred, but I think you gave me way too much credit. Let me put the credit where it's due, and that is with the founders of CONAMA Health Foundation, who started the organization 20 years ago. This is actually our 20th anniversary. And what's interesting is that in the bylaws, you will not see the word equity anywhere, yet everything in the bylaws is equity. The way CONAMA Health Foundation defines health broadly, the way that it's understood that health is more than health care, the focus on community self-definition and self-determination. In other words, CONAMA is not a prescriptive funder, but CONAMA encourages and supports communities to identify the need or the problem and to come up with its own solution. So in some of those examples I gave you earlier about basic needs, it wasn't for us to decide what a basic need was. If a basic need was childcare, then that was the basic need, so that the person could go to work, right? whatever it may be. It also includes core values such as involving the community impacted in the decision making. And I think that is key to this public health crisis currently and to health equity, going forward. It really is the core of what we're doing. We certainly have seen a trend in the last 15 years in terms of more organizations getting away from the siloed approach of the work that we do and understanding that everything is related. The food, the air that you breathe, the water that you drink, where you live, where you work, everything is related. And that's what equity is. And a big part of that is removing the barriers to good health, whatever they may be. And that includes having a, culturally relevant workforce. There are, a number of elements in health equity for it to continue and not just be a fad that is based, again, on a lot of the work that you're doing. Research-based, data-informed, right? Evidence-based practice, involving the people that are directly related in the problem solving, cultural values and practices, lifting those up, making sure that we honor, the community self-determination. It really is not a new concept. It's something that I think people of color in particular have always understood. This concept of health is, bien y sana, right? It's much more than just health care. So I don't take credit for it. I take credit for living it.
That's a nice way of describing it, because right, when we apply our values and beliefs to what we do, how we act and behave and how we view things, that's how where the action sits. And yeah, thank you for sharing that.
If I could just add, Fred,
yes, please.
if I could just add that along with that includes the spiritual health and well-being. And that's why I complimented you on the title of this Plática earlier, that it was strengths-based. It was based on a wellness model versus an illness model. It's lifting up those traditional and non-traditional practices that have served us so well, that contribute to our well-being and to our, mental health, and really lift up those practices and those values such as family, such as community, that, have served us so well.
Yeah, thanks. Yeah, we part of our value set at NABA is in fact because we believe that everything about our culture and language informs us and guides us is a whole part of what we believe is the whole person, whole health perspective. And we know that every aspect of those conditions that are spiritual in nature, physical, which is physiological and psychological, all of those are part of the whole person. And to have effective health outcomes, the person needs to benefit from the strategies in a system that has to address all of those concurrently, and preferably in a way that's unified. We see lots of challenges about that, but thank you. We absolutely believe that. And along those lines, one of the things that we have observed is the benefits of having culturally tailored content and messaging to help provide education and information to local communities. So instead of relying on national messaging, what we do is we would say is, how would we say that and how would we apply that in a local community? Because there's a local patois of sorts, ¿verdad? So the way we would have normal conversations like us today in La Plática is we would talk to each other the way we normally would talk to each other. We don't change our words so that we talk to each other as we're trying to market something to each other. We're talking to each other so we can understand the concepts that we're trying to apply. And we worked with a group in El Paso, the NYC Institute, which is Mano y Corazón, and they help revive a Chicano term called La Cultura Cura, and which we feel has been very important because it talks about how, in fact, in our culture, we talk about how important our well-being is. I always say that Latinos will always give you their perspective when you ask them the question, right? ¿Cómo estás? Y platícame más, right? And oh my God, they'll tell you so much you want to know. You just after a while say, okay, that's enough, you know. But the point being is we're not shy. I think people have misinterpreted us is what's happened. It's because they may not know the right questions to ask or to know that we want to have an opinion, but we also know that there are courtesies and nuances such as being asked for our opinion. So oftentimes people don't give us the courtesy of asking us. What they assume is that we don't have anything to say. But say something about cultural messaging. When we now have 40% of folks in New Mexico who still have decisions to make about getting immunized and addressing what they think is important to themselves and their families, what kinds of things will we be saying to people of the balance of the state? Because we still have a ways to go, right? And how will cultural messaging, from your perspective, Dr. Roybal, help to message to people the importance, the value of why this public health strategy of vaccinations is in everybody's interest, right? You want to share a little bit about your insights to that?
Yes, thank you for asking. I want to acknowledge again the 4 organizations that the W.K. Kellogg Foundation is funding related to the vaccine rollout and community rebuild. You know, that includes, as I mentioned, the New Mexico Department of Health and their vaccine equity plan, which includes on their part support for community health workers and health councils. There also is funding through the Kellogg Foundation for the UNM Center for Social Policy and the work that they're doing on data-informed research, particularly related to messaging for populations of color in New Mexico. And so the work that they're doing is going to be very helpful in terms of tailoring some of those messages to our communities. CONALMA's role will be to help disseminate that information in partnership with these other, groups, this kind of multi-sector, public-private collaboration. The other group is called Aztec for short, which stands for the Albuquerque Area Southwest Tribal Epidemiology Center. And what they're doing is working on culturally tailored messaging and communications with Native American groups. So everyone is focused on coming up with messages that can be shared with folks around the state based on the geographic and ethnic racial population. But it's also going to be done through trusted messengers such as your organization. So we'll share it with you as well, the National Latino Behavioral Health Association, such as, the New Mexico Association of Grant Makers, health councils, community health workers, interfaith and faith-based organizations. That's going to really be the key, is having trusted messages and messengers, right? Both. So I think that strategy, will be one that's really important. And, I was really happy when you asked me to participate in this program today for that reason. And I know that you've had my colleague, Robert Apodaca, that did the same. It's important that, the messages get out in different ways.
Yeah, that's absolutely right. There's absolutely no one size will work at all. We need multiple approaches, multiple opportunities, using, as you said, the multiple sectors, because in part, that's what the community is like. It's diverse. There's many pieces to it. and we recognize the value of that. I want to share that we did post on our Facebook chat just a while ago something that's really cool, right? So when we think about how do we message to each other information, right? Well, there's one thing that Latinos love besides food, right? And their family and God, right? Is music. So as a musician, we always know that music is always soothing. It inspires us. It messages us information. So we worked with a group from Los Angeles, and they were kind enough to let us use a song that was written. It's called Vacunate, and it's done in a salsa style. And we had put it on the Facebook page, and we want people to listen to it. It's all of maybe a couple of minutes long, but it's really inspiring, and it's encouraging people to get vaccinated, right? And it's done in a way that you're dancing in the kitchen or you're dancing somewhere in your house when you're listening to this song, but it's encouraging you, to get vaccinated. And why? Because it's important. Because families are the cornerstone of the Latino community, and where I've always heard Latinos and live this, and that is we do everything to support and take care of our families. But I want to share that just as a little tidbit there. But we are just like the Conalma Health Foundation, are devoted, committed to ensuring that we continue to do everything to support our states across the nation, because when you think of the nation's population, almost 19% is Latinos, so almost 1 in 5 in this nation. And we see the need is great in some states more than others. New Mexico is doing great by most standards, but we also know that we have a role to play. We can help inform and educate and continue to bring that message forward. We were actually asked to help the University of Chicago through the National Opinion Research Center on what would be messaging appropriate to reaching out to Latinos. And through that project and that effort called How Right Now, or ¿Qué hacer ahora?, we actually were able to contribute to what the CDC calls an evidence-based practice on community education, because it helps to reach and message constantly in different ways, as you said, Dr. Roybal. So I want to share that with you. We did have a comment here by our friend Corinne Chacon, and she says something here because it includes something that you can relate to. She said that she was very impressed with what New Mexico did to establish their response to COVID-19, and felt that it was very much grounded in equity, and particularly focused on the well-being of family and community. So she says it provides an exemplary model for states to be able to look at something like what was done here in New Mexico. And what advice or guidance would you offer to our colleagues in other states, right? Because she's coming from Texas, in what was considered one of the hotspots for COVID. And what people don't realize is there was some nuggets that were in those communities, like El Paso. They, for instance, in a state that has over 240 counties, imagine that, right? We have 33, they have over 240 plus counties. El Paso County was #1 in getting people vaccinated. So, so we know that in some communities, some counties, people are very committed to addressing the needs of their communities. But what advice would you give to other states about following New Mexico's example, if you will? And then we're going to ask you after that for some takeaways for the day, because I can't believe the time has flown by so fast already, Dr. Roybal, but here we are, right? Trying to cover a lot of ground. But anyway, if you could, share your response to how would you help inform or influence other parts of the country about what has happened here successfully?
Again, giving credit where credit is due, I think we have to acknowledge the work that our governor did in terms of getting out fast and in an assertive way in terms of taking immediate action to control the spread of COVID. The way that there was a centralizing of different partners that were working together, the work that we're doing now in a public-private collaborative spirit with government at all levels, including, FEMA, tribal government, state, local, the way that we are incorporating the nonprofit sector, which includes both non-grant making nonprofits and funders such as Quinalma. In fact, today we had a project team meeting and just recommended funding of 24 organizations around the state specifically focused on the vaccine rollout with hesitant populations totaling 525,000, and we will be doing another round of over 1 million to continue with the vaccine promotion and community rebuild. So the nonprofit, philanthropic, and I think we need to do a better job of including the business sector, particularly small businesses that were also hard hit by COVID. It's kind of like a three-legged stool. Government being one leg, the nonprofit sector and philanthropy being this one leg, and the business sector being the third leg. It takes all three legs to support this table of community. And I think that New Mexico was able to do that, was able to bring the different sectors together, to bring science into the picture, so to speak, in terms of bringing providers and practitioners, experts, to advise the governor and others on some activities. So I think all of that, together has made New Mexico unique and successful.
Awesome. Well, we're going to do our job here at NALBA to share today's Plática so that other states can hear about what we've done. And because we are pretty active in social media and we continue to expand our network, we have a network called the Juntos Network, and it's free, so anyone can join our network. And the reason it's free is because we want to encourage people to get information that we have to share. We have webinars and trainings, virtual learning sessions. We have leadership academies. We have tailored programming for training and technical assistance that we can provide to federal agencies, states, nonprofits, and really any organization or provider that serves Latino communities. And we're proud to say that we're now expanding our reach to communicate with all of the state mental health directors across the nation to really address the well-being of Latinos because of the mental health impact it's had on Latinos. And we knew very early on that there's more work to be done in our nation. And we know SAMHSA is going to make a big push this year to expand substance abuse and mental health services across the country. What we anticipate seeing different probably in the next year is that there's going to be an increase in the development of crisis management systems. And that's quite an undertaking, but we have some experience with that, right? Because I was involved with the city when we developed the first crisis mobile team in the city years ago. So we know the challenges before us, but so here we are, we're almost at the end of our program, and it's an opportunity for us to have you leave our listening audience with the takeaway. Something that they'll be able to hear that you think is vital to what's in store for being able to ensure that we take care of New Mexicans and their wellness, because you've been in a leadership role to help influence that. And so when you speak, people listen. You're a trusted leader, and so people know that when you speak, people will listen to that. And so what would be one takeaway, Dr. Roybal, that you'd like to leave us with before we wrap up here today? And of course, after you do that, I'll want to say some thank you to some folks that have commented on Facebook here. But so let me turn it back to you.
Thank you, Fred. I'd say that that the main takeaway is that equity is at the core of our work. That what we're dealing with now with this public health crisis with COVID-19 is a current urgent need, but we have to look beyond that. We have to continue our work with equity. You know, CONAMA was an equity foundation before equity became cool. CONAMA will continue to be an equity foundation when people may have lost interest in the term. It doesn't change the work. It doesn't change the concept. You know, the importance of everyone having an opportunity for good health, the opportunity of removing barriers to good health, and the opportunity to make sure that as Latinos that we, you know, take pride in and we support our cultural values and heritage. Mil gracias.
Oh, absolutely. Well, that's beautiful. And by the way, Corinne says, thank you for highlighting Dr. Roybal's exceptional experience and sabiduría. Your colleague, Carmen, says to say, Mana del Norte is very proud of you. And so you obviously have fans of your own, ¿verdad? Folks who greatly appreciate how much you commit yourself to New Mexico. And I know firsthand after your years of service that you have more that you will continue to do, and we look forward to partnering with you and collaborating in ways that really help to advance our respective missions, because you know we have mutual interest, and then part of that is that como dice el dicho, que una mano lava la otra y las dos lavan la cara, ¿verdad? That one hand washes the other and both hands wash the face. There's more work to be done, but we have started. Y como dice el otro dicho, que algo comenzado no es algo completado. So something started is not something finished. So there's still more work for us to do together, Dr. Roybal. And I just want to say thank you so much for joining us today, and to our Facebook listening audience. Thank you for joining us today and for chatting on the Facebook chat. We'll record this event and it'll get reposted, and we get to continue to circulate it with other Facebook groups so that they can then see and hear the information that you shared today. It helps to be a model for other places who are making efforts themselves to try to mitigate the spread of COVID-19. But the ideas and the tips and offerings of insight and expertise that you offered today, Dr. Roybal, was helpful to the people who we're trying to help, and that is our families and our communities, and particularly our children, who will be the next phase of a lot of the work that should be focused on. So with that, we're going to conclude today's Plática with our colleague and our guest, Dr. Dolores Roybal. And always great to have a norteña on this show, because it always shows that that sabiduría, as Corinne called it, is because we have folks who have committed their life's work to helping others. So with that, thank you all very much for joining us for today. And that concludes today's Plática, Latino Wellness during COVID-19. Mil gracias. Thank you.